Malpractice is an error. Negligence, if there's no harm, it's not negligence. Prevention. Primary is prevention of occurrence. Secondary is early detection. Tertiary is rehab. Disaster is plan the chain of command. Disaster preparedness is plan for potential pandemics. Disaster response is perform triage. Disaster recovery is provide potential stress counseling. Cultural repatterning. This is help modify unhealthy practices. Cultural preservation. Assist to maintain values and practices. Cultural brokering is advocate for client between culture and healthcare. Cultural accommodation is support beneficial cultural practices. Central lines. Aspirate first before anything. Have them take a deep breath and hold and bear down while you pull it out. Sterile, Trendelenburg. This is done sterilely and they're in Trendelenburg while you pull out. Infiltration. Elevate and apply a cold compress. Extravasation. Aspirate. Phlebitis and thrombophlebitis. Warm compress. Hematoma. Light pressure. Catheter embolus. Apply a tourniquet. A PIC is a central line. Pneumothorax. Administer oxygen and assist provider with chest tube insertion. Air embolism. Place client in the left lateral Trendelenburg and administer oxygen. Lumen occlusion is use a 10 milliliter syringe with a pulsing. And bloodstream infection, change entire infusion system, notify provider, obtain cultures, and administer antibiotics. Bloodstream infection and lumen occlusion are both dwell complications. TPN is central line only. It's hypertonic, PIC line or central line. You need to monitor serum glucose levels every 4 hours. Change IV tubing and fluid every 24 hours. If TPN solution is temporarily unavailable, administer dextrose 10% and water to prevent hypoglycemia. Antidote and reversal agents. Acetaminophen. The reversal agent is acetylcysteine. Benzodiazepine. Flumazenil. Curar. This is endophonium. Cyanide poisoning. The reversal agent is methylene blue. Digitalis. Reversal is digoxin immune fab. Ethylene poisoning. The reversal is fomepizole. Heparin and enoxaparin. The reversal is protamine sulfate. Iron is deferoxamine. Lead. The reversal is Socaimer. Magnesium sulfate. The reversal is calcium gluconate. Narcotics. Reversal is naloxone. Warfarin. The reversal is vitamin K. Therapeutic drug levels. Aminophylline is 10 to 20. Carbamazepine is 5 to 12. Digoxin is 0.8 to 2. Gentamicin is 5 to 10. Lidocaine is 1.5 to 5. Lithium is 0.4 to 1.4. Magnesium sulfate is 4 to 8. Phenobarbital is 10 to 40. Phenytoin is 10 to 20. Salicylate is 100 to 250. Theophylline is 10 to 20. Tobramycin is 5 to 10. The trough drug levels of gentamicin is 1 to 2. Tobramycin is also 1 to 2, and vancomycin is 15 to 20. Toxic drug levels. Acetaminophen is greater than 250. Aminophylline is greater than 20. Amitriptyline is greater than 500. Digoxin is greater than 2.4. Lidocaine is greater than 5. Lithium is greater than 2. Magnesium sulfate is greater than 9. Methotrexate greater than 10 over 24 hours. Phenobarbital is greater than 40. Phenytoin is greater than 30. Salicylate is greater than 300. Theophylline is greater than 20. Common drug class suffixes: calcium channel blocker, ends in dipene. Erectile dysfunction ends in aphil. Anesthetics is cane. ACE inhibitors end in pril. Benzodiazepines end in PAM and LAM. Anti-lipidemic is statin. Corticosteroid is azone and salone. Beta blocker ends in olol. Penicillin ends in silin. Oral hypoglycemic is IDE. Proton pump inhibitor ends in prazole. Antiviral ends in ver. Side effects and adverse reactions: ACE inhibitors, angioedema. Benzodiazepines, anterior grade amnesia. Beta blockers, bronchospasm. Ciprofloxacin, tendon rupture. Digoxin, yellow tinge to vision. Doxycycline, tooth discoloration. Furosemide, hypokalemia. Lithium, tremors. Tobramycin, ototoxicity. Valacyclovir, thrombolytic thromboionic purpura. Alpha adrenergic blockers is for BPH. Beta 1 receptors are primarily in the cardiac and renal tissues. Beta 2 receptors are found primarily in the lungs, gastrointestinal tract, liver, uterus, vascular smooth muscle, and skeletal muscle. Cardiac glycosides. The action is to increase the force and velocity of myocardial contractions to improve stroke volume and cardiac output. Slow the conduction rate, allowing for increased ventricular filling. Therapeutic uses is heart failure and atrial fibrillation. The adverse effects is digoxin toxicity. This is anorexia, blurred vision, yellow or white halos around the objects. Assess apical pulse for 1 minute prior to administration. Monitor for signs of digoxin toxicity, hypokalemia, and hypomagnesemia. Maintain therapeutic digoxin level. Anti-anginal medications. This is for dilation of arteries and veins. It's a reduced preload. The medication is IV and it decreases oxygen demand. It's given in transdermal ointment or transdermal unit patch or IV. This is for an acute angina attack. The side effects or adverse effects are headache, orthostatic hypotension, reflex tachycardia, and tolerance. Wear gloves for administration. This is nitroglycerin or nitrates. Antidysrhythmic agents are complex agents with multiple mechanisms of action. Adenosine stops the heart, get the cold cart, and EKG. Amiodarone is an ACLS drug. It's class 3. Statins cause rhabdo, which are muscle aches. Anti-lipemic medications is PM administration. The action is lowering low-density lipoprotein, which is LDL, and it increases high-density lipoprotein, which is HDL. Nursing interventions is take this in the evening, monitor liver profile, and eat a low-fat, high-fiber diet. Do not administer with grapefruit juice. Beta 2 equals the lungs. These are adrenergic agonists: albuterol, formoterol, terbutaline. Contraindication for patients with tachydysrhythmias. Anticholinergic equals dry. Methylxanthines, these are relaxation of bronchial smooth muscles resulting in bronchodilation. Theophylline, you need to avoid caffeine. All right, so the inhaler process. 1, remove cover. 2, shake the inhaler. 3, inhale and exhale. 4, place between teeth and seal lips. 5, inhale and depress canister. 6. Hold breath 10 seconds and exhale slowly. Inhaled anticholinergics. These ipratropium, do not give them this if they have a peanut allergy. It's contraindicated for clients with peanut allergy because it contains soy lecithin. Use extreme caution with narrow angle glaucoma and BPH. The side effects are dry mouth and eyes and urinary retention. Abrupt withdrawal of glucocorticoids equals Addisonian crisis, and long-term use of glucocorticoids equals Cushing's. Teach client about gradual reduction of dose to prevent Addisonian crisis. Rinse mouth to avoid thrush. Leukotriene modifiers. This is Zephyr Lucast. These have suicidal ideations. Long-term management. This is the therapeutic use is long-term management of asthma in adults and children. Oral hypoglycemics. These are taken 3 times a day. These are alpha glucoside inhibitors like acarbose. You take with the first bite of food 3 times a day. Biguanides, this is metformin. You monitor for lactic acidosis. Withhold 48 hours prior to and 48 hours after a test with contrast media. Gliptins is sitagliptin. You monitor for pancreatitis. Meglitinides, this is repaglinide. You take 3 times a day, 30 minutes before a meal. Sulfonylureas, this is glipizide. Hold if unable to eat. And thiazolidinediones, this is pioglitazone, and monitor cholesterol. Insulin. Okay, so there are 4 types of insulin. Rapid acting, this is Lispro. Eat, and at night, the onset is 15 to 30 minutes, and the peak is a half hour to 2.5 hours. Short acting is regular insulin. This is a half hour to 1 hour onset, and the peak is 1 to 5 hours. Take this with juice. And the intermediate, which is NPH, this is going to appear cloudy. You take the onset is 1 to 2 hours, and the peak is 6 to 14 hours. Long acting is insulin glargine. The onset is 70 minutes, and there's no peak. The therapeutic uses is for type 1, type 2, and gestational diabetes. If you're pregnant and if you have hyperkalemia. The precautions and interactions is when mixing regular with NPH insulin, draw up regular first. When hanging an IV insulin, which is the regular, waste the first 50 milliliters that runs through the tubing. AC equals at meals, HS equals bedtime. Thyroid hormone, this is levothyroxine or T4. Thyroid USP and Leotrix. The side effects is tachycardia. You take this daily 30 minutes before breakfast. This is for symptoms of the symptoms of hypothyroidism is low and slow. Thyroid hormone antagonist. Methimazole, propylitheracil, which is PTU. Monitor CBC for agranulocytosis and CMP for liver function. Radioactive iodine destroys thyroid-producing cells. Posterior pituitary hormones, this is desmopressin. Desmopressin is for hemophilia, DI, and nocturnal enuresis. Vasopressin increases blood flow to brain and heart during CPR. Adrenal hormone replacement is dexamethasone, hydrocortisone, and prednisone. This is for insufficient adrenal hormone is Addison. Long-term use is Cushing's. Electrolyte imbalances is hypokalemia and hypernatremia. Blow nose before administration. Administrating blood products. So for whole blood, this is for hemorrhages. Packed RBCs, you're going to give this for severe anemia, hemoglobinopathies, and erythroblastosis fetalis. Platelets is for active bleeding, thrombocytopenia, aplastic anemia, and bone marrow suppression. Fresh frozen plasma is for hemorrhage, burns, shock, thrombotic, thrombocytopenic purpura. Blood transfusion reactions. Hemolytic. You're going to have chills, fever, low back pain, first 50 milliliters of infusion. You're going to stop the infusion and maintain normal saline IV. Anaphylactic is anxiety, wheezing, urticaria, shock, cardiac arrest. Stop the infusion, maintain normal saline IV, give CPR and epi. Mild allergic is urticaria, flushing, itching. You're going to stop the infusion, maintain normal saline IV, give antihistamines and steroid, and give them leukocytes, which is washed blood. Circulatory overload. This is going to have a cough, shortness of breath, crackles, hypertension, JVD, tachycardia. You're going to assist to sitting position, legs down, administer oxygen and diuretics. Hyperkalemia. This is due to cell lysis. They're going to have bradycardia, dysrhythmias, muscle twitching, and paresthesis. More likely in products older than 1 week. The blood products are older than 1 week. And febrile is reaction to donor white blood cells. They're going to have fever, chills, headache, flushing, and anxiety. You're going to stop the infusion and maintain normal saline IV and administer acetaminophen. Blood administration steps. 1. Verify labs, prescription, and sign consent. 2. Verify IV of normal saline, 20 gauge, larger access. 3. Obtain PRBCs from blood bank. 4. Verify client ID and compatibility. 5. Obtain baseline vitals. 6. Initiate transfusion slowly and monitor for 15 minutes. And 7. Complete within 4 hours. Flash pulmonary edema is pink, frothy sputum. Epoetin alpha stimulates RBC production for chronic kidney disease and chemotherapy, and zidovudine use. The side effects is hypertension and body aches. Filgastrum stimulates white blood cell production, neutropenia related to cancer. This is an autologous transplant. The side effects is bone pain. Oprelvecin stimulates platelet production. It's thrombocytopenia and it's related to cancer. Sargrammostatin stimulates neutrophils and it's used for bone marrow transplants. Monitor for diarrhea and bone pain. Iron preparations. Dilute liquid preparations with juice or water and administer with a plastic straw or medication dosing syringe. Avoid contact with teeth. Encourage orange juice fortified with vitamin C. Vitamin C facilitates absorption. Avoid antacids, coffee, tea, dairy products for 1 hour before or after administration, and monitor the client for constipation. The Z-track method is how it's given, never in the deltoid muscle. Anticipate dark tarry stools and take with food. The toxicity, the antidote is deferoxamine. Anticoagulants are heparin and enoxaparin. Those are parenteral, and oral is warfarin and dabigatran. The medication use is pulmonary embolism, deep vein thrombosis, and MI. The toxicity is hemorrhage, hematuria, and thrombocytopenia. Heparin is the only one safe for pregnancy. For heparin, you're going to monitor the APTT every 4 to 6 hours for IV, monitor signs of bleeding, and the safety precautions to prevent bleeding. Protamine sulfate is for heparin toxicity, and 1 milligram neutralizes 100 units of heparin. Warfarin, you're going to monitor the INR or the PT. Avoid NSAIDs. Administer vitamin K for warfarin toxicity. Garlic, ginger, ginkgo, may increase bleeding, and ginseng blocks the effects of warfarin. Antiplatelet medications. Okay, aspirin, abiximab, and clopidogrel, and diframadrol. If you see two of these together on the chart, you need to question why. Administer ASA 325 milligrams during acute MI. Therapeutic uses is prevention of acute myocardial infarction or reinfarction or acute coronary syndromes. Prevention of stroke and TIA and intermittent claudication. This is lower leg pain indicating a PAV. Monitor toxicity. The side effects is prolonged bleeding, gastric bleeding, and thrombocytopenia. Discontinue 7 to 10 days before surgery. Do not crush or chew thrombolytic medications. This is alteplase, which is TPA, tenecteplase, or retaplase. So all the places do not crush or chew. They dissolve the clots. The therapeutic uses is acute myocardial infarction, massive pulmonary emboli, and ischemic stroke. You're going to give alteplase for an ischemic stroke. Precautions and interactions is GI, GU, and cerebral bleeding. Contraindication for intracranial hemorrhage, active internal bleeding, aortic dissection, and brain tumors. Or if someone has an ischemic stroke in the past 3 months. Administration must take place within 4 to 6 hours of symptom onset of a stroke. You're going to need baseline labs, IV only, and follow with beta blockers and heparin. Okay, so the medications for the gastrointestinal system. Anti-secretory and blocking agents is omeprazole. You're going to take this before a meal. This is used for GERD. You're going to monitor fluid and electrolyte imbalance, sedation, EPS, osteoporosis, and pneumonia. Anti-ulcer is mucosal protectants. This is sucralfate. This is cimetidine, misoprostol, antacids, and imosaprol. Monitor for diarrhea and dysmenorrhea. Misoprostol for fluid electrolyte imbalance. Antiemetics. Monitor for sedation, EPS, hypotension, and anticholinergic effects. This is promethazine, ondansetron, and scopolamine. Also cannabinoids. Prokinetics is metoclopramide. Monitor for EPS, sedation, and tardive dyskinesia. Hydroxychloroquine, take with food and monitor for fever. Celecoxib, take with milk or antacids, protects against colorectal cancer. Colchicine, you need a baseline CBC. Methotrexate, inspect the mouth and gums daily. Obtain a CBC every 3 to 6 months. Prednisone is watch out for severe hypotension, and this can occur if stopped abruptly. IBD medications, hydrocortisone, mesalamine, probiotics, and azathioprine and infliximab, metronidazole. Monitor CBC for agranulocytosis, anemia, fever, and Cushing's and flatulence. Antidiarrheals. Monitor for fluid and electrolyte imbalance. Avoid plain water and avoid caffeine. Stool softeners. Psyllium. Decreased diarrhea. This is a bulk-forming laxative. Docusate sodium. This is for relief of constipation. It's a surfactant. Biscodoil. Pre-procedure colon evacuation. This is a stimulant. And magnesium hydroxide or milk of magnesia. This prevents painful elimination. This is a low-dose osmotic, and it promotes rapid evacuation for a high-dose osmotic. You need to monitor for dehydration, fluid and electrolyte imbalance, hypermagnesemia, and dependence. Diuretics, furosemide, and bumetanide. The side effects is loop and thiazide diuretics. Watch out for ototoxicity. This is in loop diuretics. hypokalemia, hyponatremia, hyperglycemia, increased lipids. So for the potassium-sparing diuretics, you need to watch out for hyperkalemia and endocrine effects, such as impotence and menstrual irregularities. With this, you're also going to experience drowsiness and metabolic acidosis. Osmotic diuretics, this is mannitol or glycerin. Side effects is pulmonary edema, which is heart failure, and fluid and electrolyte imbalances, also metabolic acidosis. Blood cultures are drawn before antibiotics. Which medication might be given for treatment? Hypertension, angina, and heart failure. This is going to be metoprolol. Infection when client has penicillin allergy. This is azithromycin. Prevent urinary incontinence. This is oxybutynin. Menopausal symptoms. This is estradiol. GERD and allergic reaction. This is famotidine. Erectile dysfunction. This is varendafil. Vitamin D deficiency. Ergocalciferol. Bipolar disorder. Quetiapine. Chronic obstructive pulmonary disease, or COPD. This is tiotropium. Depression. Duloxetine. Herpes zoster. Valacyclovir. And seasonal allergies is cetrizine. TPN is a hypertonic solution. TPN may be given via PICC line and central line. TPN is prepared daily. If the next TPN bag is unavailable, infuse dextrose 10 to 20%. This lab value is checked every 4 to 6 hours when TPN is initiated. Oh wait, I didn't get that one. A new TPN bag is hung every 24 hours. A new filter and tubing is hung with each bag. This is true. When mixed with regular insulin, draw this medication up last, NPH. The client should eat as soon as this medication is given, acarbose. Hold this medication 48 hours before and after use of contrast dye, metformin. This medication is given subcutaneously and has no peak action time, insulin glargine. This medication might be used to lower serum potassium levels regularly. What is the minimal PPE requirement? Okay, for standard, it's gloves, gown, mask, and goggles. These are all PRN. Contact is glove, gown, and then mask and goggles is PRN. Droplet is mask, gloves, gown, and goggles. They're all PRN. So the client wears the mask if they're leaving the room. And airborne is mask, respirator, N95, TB, or SARS. Gloves, gown, and goggles are all PRN. Select the nursing consideration. Metformin, supplement with B12 and folic acid. Omeprazole, increase vitamin D and calcium. Amlodipine, monitor blood pressure. Propofol, have resuscitation equipment nearby. Simvastatin, report muscle aches and pain. Bupropion, contraindicated with seizure disorder. Amoxicillin, caution with cephalosporin allergy. Clozapam, monitor for drug dependency. And methylphenidate, monitor weight. So analgesics, the uses, so we have acetaminophen, NSAIDs, and opioids. So the uses is analgesic, so acetaminophen, NSAIDs, and opioids. Antipyretic is acetaminophen and NSAIDs. Anti-inflammatory is NSAIDs. Antiplatelet is NSAIDs. The side effects is renal damage, NSAIDs. Liver damage, acetaminophen. Respiratory depression is opioids. Bipolar disorder medications, lithium carbonate. The therapeutic use is bipolar disorder. Side effects are fine hand tremors, polyuria, hypothyroidism, drowsiness, weight gain, and goiter. Nursing interventions is monitor therapeutic levels, monitor serum sodium levels, avoid NSAIDs and increase fluid intake. Toxicity is early GI distress, confusion, tremors. Late is ataxia, blurred vision, and hypotension. Severe is oliguria, seizures, and coma. Antipsychotic medications. Typical is chlorpheniramine and haloperidol. Atypical is ariprazole and olanzapine. The side effects for typical is sedation, EPS, anticholinergic effects, tardive dyskinesia, agranulocytosis, and neuroleptic malignant syndrome and seizures. Atypical is agranulocytosis, diabetes, dyslipidemia, orthostatic hypotension, and EPS. Anti-Parkinson's medication increases dopamine. This is levodopa-carbidopa. The side effects is drowsiness, dyskinesia, dysrhythmias, and orthostatic hypotension. Take it with food and instruct client to avoid high-protein meals and snacks. Client safety, falls. This is increased risk for falls is older age, impaired mobility, and adverse effects of medication. Complete a fall risk assessment. Restraints. Document behaviors making restraint necessary, alternatives attempted in the client's behavior while in restraints, type and location of the restraint and time applied, and frequency and type of care. For example, range of motion, removal. Seizure precautions. First is ABCs in the post-ictal phase. Place rescue equipment at the client's bedside, including oxygen and oral airway and suction equipment. Do not put anything in the client's mouth. And always, first is loosen restrictive clothing and then do ABCs or ABCs first, whichever you feel like you want to do. How to move an immobile patient to their right side. Okay, so number 1, place supine and move to side of bed. 2, flex left knee and roll towards the nurse. 3, place pillow under head and neck. 4, move right shoulder forward. 5, position pillows. 6, position arms. Environmental safety, fire. This is race. Rescue, alarm, contain, extinguish. Extinguish properly. This is pass. Pull, aim, squeeze, and sweep. Pressure is preventable. Risk assessment, early skin obstruction. Set up appropriate mattress, seat cushions, use wound assessment, and reposition and evaluate regularly. Oh, this is for ergonomics and client positioning. Lifting and transfer of clients. Lift with legs. Avoid twisting the thoracic spine or bending at the waist. Use major muscle groups and tighten abdominal muscles. Client transfer and prevent positioning. Prevent pressure injuries. Move every 2 hours. Float extremities and use methyl pads. So the high Fowler's position improves oxygenation. This is a head of bed elevated to 90 degrees. Lateral side lying is safety with seizures. Semi-Fowler's is head of bed elevated to 30 degrees. Assistive devices for ambulation, crutches. So assess the client for correct fit of crutches. They need to be approximately 3 finger widths between the axilla and top of the crutch. Position hands on hand grips with elbows flexed at 30 degrees. Do not bear weight on the axilla. For weight-bearing crutches, you need to move crutches forward about 1 step's length and move effective leg forward. This level up with the crutch tips. Move the ineffective leg forward second. Then continue the sequence, making steps of equal length. Non-weight bearing is begin in the tripod position. Maintain weight on the unaffected weight bearing extremity. Then advance both crutches and the affected extremity. Then you're going to move the unaffected weight bearing foot or leg forward beyond the crutches, and then advance both crutches and then the affected extremity. Continue this sequence, making steps of equal length. Standard precautions. This is Tier 1. PPE as needed to prevent contact with body fluids. This is gloves, mask, gown, and goggles. AIDS is clean with bleach. Transmission-based precautions is Tier 2. This is airborne precautions. This is for air infectious agents smaller than 5 micrograms, like measles, varicella, pulmonary, or laryngeal tuberculosis. The PPE is a mask, N95, respirator for known or suspected TB. Droplet precautions, the PPE is a mask. Contact precautions, the PPE is gloves, gown, as needed, use of mask, and goggles. AIDS and HIV is standard precautions. Chickenpox or varicella is standard airborne and contact precautions. C. diff is standard and contact enteric precautions. TB is standard and airborne precautions. The considerations is an N95 mask. Client wears surgical mask when transported outside of negative airflow room. Fluid imbalance. This is manifestations is weight loss. IV fluids is isotonic. This is no fluid crosses the cell membrane. This is normal saline at 0.9%. Hypotonic, this is where fluid moves into the cell. This is 0.45 normal saline. Hypertonic is fluid moves out of the cell. This is D5 normal saline. Fluid volume excess is FVE. This is for weight gain, or the manifestations is weight gain. 1 liter of water equals 1 kilogram of weight. Okay, so fluid volume excess and fluid volume deficit. So weight gain is going to decrease with fluid volume deficit and increase for fluid volume excess. Hematocrit, it's going to increase for deficit and decrease for excess. Vitals is going to be a thready pulse for deficit and bounding pulse for excess. I don't know what the fuck that is. Level of consciousness is deficit. It's going to be altered for both. Blood osmolality is going to increase for deficit and decrease for excess. And neck veins are going to be flattened for deficit and distended for excess. Urinary output is going to be decreased for deficit and increased for excess. Hyperkalemia. This is peaked T waves. Hyponatremia. Seizures. Hypocalcemia. Chovestek and Trousseau signs. Hypercalcemia. Pathologic fractures. ABG is gold standard. Acid-base imbalances. Normal value of pH is 7.35 to 7.45. PCO2, which is respiratory, this is 35 to 45. HCO3 is metabolic, this is 21 to 28. For metabolic acidosis, the pH is low. The CO2 is normal and the bicarb is low. Metabolic alkalosis, the pH is high, the CO2 is normal, and the bicarb is high. Respiratory acidosis, the pH is low, the CO2 is high, and the bicarb is normal. Respiratory alkalosis, the pH is high, the CO2 is low, and the bicarb is normal. Remember the normals, pH 7.35 to 7.45, CO2 is 35 to 45, HCO3 is 21 to 28, PaO2 is 80 to 100, and O2 sat is 95 to 100. Watch Mint Nursing ABGs on YouTube. The base is below the belt, alkalosis. Respiratory emergencies, pulmonary embolism. This is a life-threatening hypoxic condition caused by a collection of particulate matter, like solid gas or liquid that enters the venous circulation. Manifestations is dyspnea, tachypnea, diaphoresis, restlessness, anxiety, and hemoptysis. Nursing interventions is assess respiratory status and vital signs. Give morphine for pain management. Medications is thrombolytics and anticoagulants. Monitor for complications. Pneumothorax. The interventions is give O2, position, anoxylytics, analgesics, and a chest tube. Intermittent bubbling is expected in water-sealed chamber. Continuous is not. Titling equals obstruction. Chest tube complications. Do not clamp. Keep below insertion site. So an air leak is a continuous rapid bubbling in the water-sealed chamber. Monitor it. No titling in the water-sealed chamber. Check for kinks in the tubing. No bubbling in the suction control chamber. Verify that tubing is attached. Chest tube accidentally pulled from client. Cover insertion site with sterile dressing, taped on 3 sides, and contact the provider. Mechanical ventilation. The interventions is suction, assess breath sounds, support vent tubing, up, manage client, not the alarms, and assess and maintain cuff pressure. Preoperative care. Dehiscence is wound opening. Evisceration is coming out or protruding. Common postoperative complications. Hypostatic pneumonia. It occurs 48 hours after. Nausea is immediate to 48 hours. Urinary retention is immediate to 3 days, and you're going to give a bladder scan. Decreased peristalsis and paralytic ileus occurs 2 to 4 days. Wound hemorrhage is immediate to discharge. Bleeding from drainage tubes or surgical site and signs of shock. Thrombophlebitis, this occurs 7 to 14 days. Manifestations is redness, warmth, calf tenderness, pain, edema at the site. Wound infection occurs 3 to 5 days. Wound dehiscence or evisceration is 4 to 15 days, and it's an open wound revealing underlying tissue, that's dehiscence, or organs is evisceration. Okay, so for an NG tube, you're going to check the residual. This is leftover feed in the stomach. This is expected. The pH is 7. Put it back. Head of bed is 30 degrees at minimum. Meds is crushed one at a time and flush after. Not flush after each. Do not do enteric-coated or time-release medication. So do not crush enteric-coated or time-release medication and put it in someone's NG tube, for the love of God. Assess. Aspirate, color, throat comfort, device stability, mouth hydration, and Nair's condition. NG tubes. So the purpose is to decompress the stomach, ileus gastroautonomy, or intestinal obstruction. You're going to do an x-ray to verify placement and check pH aspiration. It's going to be yellow. That's normal. Not confuse inflammatory bowel disease with irritable bowel syndrome, which is much less severe. Inflammatory bowel disease is an autoimmune disorder and includes Crohn's disease and ulcerative colitis. Crohn's disease is an inflammation of the GI tract that extends through all layers. The manifestations is abdominal pain, right lower quadrant, does not resolve with defecation, pain is aggravated by eating, diarrhea and stratorrhea, high calorie protein, low fiber, no dairy, low right quadrant pain, and skip lesions. Nursing interventions is nutrition therapy, includes high calorie, protein, low fiber, no dairy. Ulcerative colitis, superficial mucosa of the colon, usually begins in the rectum and spreads proximally through the entire colon. The diet is low residue, high calorie, low protein. Manifestations is liquid, bloody stool, 10 to 20 per day. Left lower quadrant abdominal pain. Bleeding is common with ulcerative colitis. This helps differentiate it from Crohn's disease, in which bleeding is rare. Residue is considered something that is coated. It's fat. Gastric surgical procedures. This is bariatric surgery for morbid obesity. Morbid obesity is more than 2 times the ideal body weight, which places clients at risk for multiple health problems. No fluids 1 hour before or after food, and avoid simple carbs. Assist client to ambulate as soon as possible and the day of surgery. Collaborate with dietitian to introduce 6 small feedings per day. Begin with 1 ounce cups of clear liquids. Increase amount as tolerated. Monitor for manifestations of dumping syndrome, which is tachycardia, nausea, diarrhea, abdominal cramping, palpitations, and hypoglycemia. Colostomy is a surgical procedure that brings the end of the colon
through the abdominal wall, creating an opening for the evacuation of fecal material. It may be temporary or permanent. Probiotics in cranberry juice, clip hair surrounding the site, empty ostomy bag when a quarter to a half full, offer emotional support, refer them to a support group. Post-op, NG is low intermittent suction. Stoma perfusion is color that is pink and red. Stool is LR equals liquid, LL equals soft formed. Get emotional support and self-care education. Hepatic disorders, cirrhosis. This is a chronic disease characterized by extensive irreversible scarring of the liver that disrupts the structure and main function. Manifestations. Cirrhosis is bleeding. Hepatitis is flu-like symptoms. Pancreatitis is flank ecchymosis. Pancreatic cancer is glucose intolerance. For cirrhosis, restrict protein, but do not eliminate it. Arthritis. Inflammation of one or more joints, which results in pain, swelling, stiffness, and limited movement. Osteoarthritis is progressive degenerative deterioration and loss of cartilage in one or more joints. It's unilateral. The manifestations is pain is diminished after rest and worsens after activity. Heberden's nodes, which is closest to the ends of the fingers and toes, and Bouchard's nodes is middle joints of fingers or toes. Nursing interventions is instruct client to use ice or heat for comfort. Medications is NSAIDs, corticosteroids, glucosamine, and chondroitin sulfate. Rheumatoid arthritis is bilateral, chronic, progressive, autoimmune connective tissue disorder, primarily affecting synovial joints. Manifestations is morning stiffness, pain at rest or after immobility. It's a bilateral joint inflammation with decreased range of motion. Nursing interventions instruct client to use ice or heat for comfort. Medications is NSAIDs, corticosteroids, DMARDs, methotrexate, leflunomide, and hydroxychloroquine. Gouty arthritis. This is systemic inflammatory disease caused by problems with purine metabolism, primary gout, or hyperuricemia, which is secondary gout. The contributing factors is excessive alcohol intake, high intake of foods with purines such as organ meats, yeast, sardines, and spinach. The manifestations is excruciating pain and inflammation in one or more small joints, like the great toe is most common. It appears warm and red. Appearance of tophi, which is deposits of sodium urate crystals, generally appear after years of gouty arthritis. So the manifestations are tophi, urate crystals, renal stones, and excruciating pain. The nursing interventions is maintain bed rest during acute attacks. Do not touch it. A low purine diet. Promote liquids, intake of 3 liters a day. Limit foods high in purine. Medications for the acute phase is colchicine. This is going to have diarrhea. Chronic treatment is allopurinol. NSAIDs, corticosteroids, and injection of corticosteroid if affected joint by the provider. Avoid organ meat, which is like liver. Fractures, so a break or disruption in the continuity of bone tissue. So there's 5 types: closed, comminuted, compression, displaced, and green stick. The highest risks for a fat emboli is in the long bones. Collaborative care is assess client's neurovascular status, which are the 6 Ps, noting bilateral comparisons: pain, pressure, paralysis, pallor, pulselessness, and paresthesia. Also check the cap refill. Monitor for complications of fat embolism, which would include confusion, anxiety, tachycardia, tachypnea, and petechiae. Monitor for complications of compartment syndrome, which is irreversible if compromise persists beyond 4 to 6 hours. A fasciotomy is done to fix compartment syndrome. Traction is put the patient in a normal alignment position. Skin traction provides a mechanical pulling force to overcome muscle spasms to immobilize or relieve pain. There's 4 types: Bucks, Bryant, cervical halter, and pelvic. So positioning, assessment, pin site care, maintain alignment, and neurovascular care are the things that you need to know for traction. Endocrine system functions and disorders. What you need to ask yourself when you see these: what is the function of the gland? How does hyposecretion look in the meds? And how does hypersecretion look? And you're going to give meds, radiation, and remove the gland. So the posterior pituitary gland, you're going to give vasopressin. This is an anti-diuretic hormone, and oxytocin. Diabetes insipidus, a deficiency of anti-diuretic hormone due to a disorder of the posterior pituitary gland. ADH helps control water and sodium, controls blood pressure and amount of urine kidneys make. Deficiency in ADH equals diabetes insipidus. The adrenal glands regulate stress response and helps control the sleep-wake cycle. The adrenal gland produces glucocorticoids, which is cortisol, mineral corticoids, which is aldosterone, and sex hormones. Disorders of the adrenal cortex. This is Addison's disease. Adrenal insufficiency. This means decreased sodium, decreased sugar, decreased steroid. With Addison's, you need to add cortisol. With Cushing's and Cushing's syndrome, everything is increased: steroids, sugar, and sodium. The 4 S's of Cushing's and Addison's disease. So Cushing's disease, the big S's: steroids, sugar, sodium, and skin, all increased. And the skin is thin, fragile, and striae. Addison's disease is the small S's. Steroids, you need to add steroids, which is decrease. Sugar is decreased. Sodium is decreased, and the skin is hyperpigmented. Hypothyroidism. The manifestations are constipation, dry skin, brittle hair and nails, and depression. Hyperthyroidism. Think Graves' disease. It's the most common type of hyperthyroid disease and causes overstimulation of the thyroid by circulating immunoglobulins. Manifestations is tachycardia, intolerance of heat, weight loss despite food intake. And the most life-threatening is thyroid storm. It's seen in untreated or uncontrolled hyperthyroidism. Manifestations include hyperpyrexia, tachycardia, and hypertension. The nursing interventions is assess vital signs, report temperature increase of 1 degree or greater to provider immediately. Disorders of the pancreas. Diabetes mellitus. Type 1 is autoimmune. Type 2 is inadequate insulin production and insulin resistance. Contributing factors is age. Metabolic syndrome. Big gut, no butt. The risk factor is older age, characterized by hypertension, hypercholesterolemia, and abdominal obesity. Glycemic control is glucose control is monitored on a day-to-day basis by capillary blood glucose levels. Glucose control is monitored on a long-term basis by HbA1c, which is glycosated hemoglobin. Long-term complications is neuropathy, retinopathy, and cardiovascular disease. Also skin ulcers, hypertension, and proteinuria. So your daily intake is going to be 45% carbs, 15 to 20% protein, and 20 to 30% unsaturated fats. So unsaturated fats are liquid at room temperature. You're going to exercise 150 minutes a week, and the meds are going to be insulin and anti-diabetics. Okay, now we're on to anemia. So we're going to match the anemias. Renal disease is decreased erythropoietin. Iron deficiency is weakness and pallor. Aplastic anemia is low red blood cells and white blood cells and platelets. Pernicious anemia is B12 malabsorption. Hemolytic anemia is premature red blood cell destruction. Sickle cell is joint pain, and thalassemia is facial bone deformity. Okay, now on to cardiovascular disorders. So the P wave indicates atrial depolarization. QRS is ventricular. Angiography is a balloon stent. So pre-procedure for an angiography is NPO, baseline vitals, and assigned consent. You're going to assess renal functions and allergies. Pre-medications is methylprednisone and diphenhydramine. They're going to mark the distal pulse. You're going to teach about sedation, taste, and warm sensation. And then the post-procedure, you're going to put them in a supine position. Check the vital signs, cardiac monitoring, antiplatelet aggregators. You're going to do intake IV and output, pressure dressing, and assess extremity, bleeding, and hematoma. Also assess for thrombosis, which is a clot. Myocardial infarction. So the manifestations is severe chest pain, unrelieved with nitroglycerin or rest. Cushing's, crushing quality, radiates to jawline, left arm, neck, and or back. So something to remember, women, older adults, and clients who have diabetes mellitus often report no pain. Okay, so diaphoresis, nausea, vomiting, anxiety, fear, numb arms, and it's relieved with morphine. So the priority nursing interventions is oxygen, ECG, CKMB, TROPE, BNP, and CRP IV access. You're going to administer oxygen, aspirin, antidysrhythmics, which is amiodarone and lidocaine, analgesics, which is morphine sulfate, thrombolytics within 30 minutes, vasodilators, which is nitroglycerin, beta blockers, which is metoprolol, within 24 hours, and frequently monitor vital signs, O2 sats, and ECG. You're going to discharge them with a prescription for a beta blocker and an antiplatelet aggregator. Heart failure. Left-sided heart failure is lungs, frothy sputum, dyspnea, cough, and crackles. Right-sided heart failure is the rest of the body, dependent edema, weight gain, and jugular vein distension. Valvular disorders result in narrowing of valve that prevents or impedes blood flow, which is stenosis, or impaired closure that allows backward leakage of blood, which is regurgitation. Contributing factors is dizziness and syncope, right-sided heart failure, which is mitral stenosis, mitral regurgitation, and tricuspid stenosis. So venous is going to be painless ulcers, edema, and hyperpigmentation. Arterial is going to be claudication, delayed CRT, hair loss on legs, and cyanotic extremities. Aortic aneurysm is going to contribute, the manifestation is going to be a gnawing back pain. Cardiac surgery, a coronary artery bypass graft or CABG. The preoperative general care is obtain baseline vitals. Postoperative care is assess allergy for the first 8 hours, and the ratio is 1:1. Fluid and electrolyte INO imbalance, ambulate. The pain, note the type, location, and intensity. Do a 3 a.m. glucose check. Sterile dressings. Check the pacer wires and no CPR. Monitor for cardiac tamponade, which is muffled heart sounds. Okay, GU disorders. So for a UTI, you're gonna monitor for dysuria frequency. Nephrotic syndrome is severe proteinuria. AKI is oliguric, and I don't know what that is. Something diuresis. Urolithiasis is renal colic. Hypertension and hematuria is glomerulonephritis. Dialysis. So hemodialysis is shorter treatment and more efficiency clearance. Monitor the client's blood pressure continuously during the procedure. Complications are infection, closure, disequilibrium syndrome, and hypotension and bleeding. Peritoneal dialysis, the advantage is mobility, fewer hemodynamic complications. So the complications include infections, hypoalbuminemia, poor outflow, cold shock, and bowel perforation. The interventions is assess circulation, hold the meds, weigh before and after, do vitals, and monitor labs. Continuous ambulatory peritoneal dialysis, or CAPD. So the procedure is fluid is infused by gravity, 1.5 to 3 liters, 4 to 5 exchanges daily, 7 days a week. So some clients may elect to do at night with automatic cycling machines. They're going to do 10 to 14 hours 3 times a week. Continuous cycling peritoneal dialysis is CCPD. Prostate cancer. So prevention, age 40. Detection, manifestations, and care. Prostate-specific antigen, which is PSA, is greater than 10. Testicular cancer, this is the testosterone receptor cancer. Contributing factors is detection, manifestations, and care. A CT scan monitors the type of cerebral vascular accident. An MRI, do not use with a pacemaker. Increased ICP. Contributing factors is head injury with subdural or epidural hematoma, brain tumor, hydrocephalus, and a ruptured aneurysm or subarachnoid hemorrhage. Manifestations, the earliest sign is changes in level of consciousness, such as restlessness, confusion, drowsiness, lethargy, or stupor. Motor and sensory changes. Nausea and vomiting is often projectile. And then also changes in vitals, so watch out for Cushing's triad. This is hypertension with widening pulse pressure, bradycardia, and irregular breathing. This is considered Cheyne-Stokes respirations. Late signs are widening pulse pressure, bradycardia. And fixed dilated pupils means they're dead. Nursing interventions is maintain alignment, report fever immediately, and halo sign of CSF. Monitor vital signs and neurological function, and keep the head of bed elevated to 30 to 45 degrees. The medications is mannitol, barbiturates to place the client into a therapeutic coma, and osmotic diuretics such as mannitol. Seizure disorders. So during, you're going to protect the airway, provide suction PRN, protect from injury, position on the side, loosen the clothing, observe and document time. After, you're going to check the airway and give oxygen, keep slide lying, check the vital signs, do neural checks, and reorient and calm the patient. Multiple sclerosis is a chronic, progressive, immune-mediated disease of the CNS characterized by patches of demyelination in the brain and spinal cord. Parkinson's disease is a chronic, progressive neurological disorder caused by the loss of pigmented cells of substantia nigra and depletion of dopamine. Amyotrophic lateral sclerosis, or ALS, is progressive and variably fatal neurological disease that attacks nerve cells, which are neurons, that control voluntary muscles, also known as Lou Gehrig's disease. Myasthenia gravis is an autoimmune disorder in which antibodies are produced. It is thought by the thalamus gland. Guillain-Barré is acute autoimmune attack on the peripheral nerve and some cranial nerve myelin. Chemotherapy is targeted site, and it's going to go through the central PICC line. Thrombocytopenia is administer prescribed platelet transfusions. Opravelkin to increase platelets. Implement bleeding precautions. Avoid use of aspirin. Provide soft, bland, high-protein foods at room temperature for stomatitis and use a straw for fluids. Rinse mouth with a topical anesthetic. May need topical steroids and zinc supplements. AIDS, acquired immune deficiency syndrome. HIV infection is divided into 4 stages. Stage 1 is acute infection. You're going to have worst flu ever. Stage 2 is latency. It's asymptomatic. This stage can last up to 8 years or longer. Stage 3 is AIDS. CD4 and T cell count drop below 200. The body becomes susceptible to opportunistic infections. Survival in this stage is usually 1 to 3 years. In stage 4, HIV infection is stage unknown. Contributing factors is unprotected sex, pregnancy and breastfeeding transmission from mother to baby. The manifestations are fever in stage 1. Stage 2 is lymphadenopathy, but asymptomatic. And stage 3 is Kaposi sarcoma, which is basically the rashes all over the body, the circular rashes. Wasting syndrome and AIDS dementia. The nursing interventions is teach about transmission routes. Stage 3 is prevent infection, monitor weight and encourage high-calorie foods, provide scrupulous skin care. Medications is highly active antiretroviral therapy guidelines, which is HART, and it is crucial that once a client begins HART therapy, that doses must not be missed. Doing so contributes to medication resistance and reduces medication treatment options. Okay, so the rule of nines. Head is 9%, front and back. Back is 18, chest is 18. Right arm is 9, left arm is 9. Perineum is 1, right leg is 18, left leg is 18. The Parkland formula is 4 milliliters times kilogram body weight times percentage of total burn surface area. Nursing interventions is maintain airway and ventilation, provide humidified oxygen as prescribed, give 4 milliliters per kilogram per percent burn, give half of the total fluids in the first 8 hours, give the second half over the remaining 16. Deduct any fluid given pre-hospital from the amount to be infused in the first 8 hours. This is going to be done through the central line and monitor urine output. Maintain urine output of 30 to 50 milliliters per hour for a burn client. Provide pain management. Client with a large burn injury will be in hypermetabolic state and may exceed 5,000 calories a day. Promote restoration of mobility, provide psychological support, and prepare for PTSD and sexual function. Treatments is wound care. End-of-life care is providing good death. A good death is free from avoidable suffering for patients and families. So expected, peaceful, timely, respects end-of-life decisions, and communicates clearly with client and family. So your postmortem care is going to be remove the tubes, bathe and dress and place dentures, position supine, cover with sheet, close the eyes, and ensure natural position. Grief is considered normal, anticipatory, prolonged, and complicated. High protein diet is soy products, fish and fowl, organ and meat sources. Potassium modified diets are bananas, oranges, apricots, and prunes, and baked potatoes, sweet and white. Okay, on to lab values. Serum electrolytes, sodium 136 to 145, potassium 3.5 to 5, calcium 9 to 10.5, magnesium 1.3 to 2.1, phosphorus 3.0 to 4.5, chloride 98 to 106, ABGs, pH 7.35 to 7.45, PaCO2 35 to 45, O2 80 to 100, bicarbonate 21 to 28, CBCs, so the red blood cells for males is 4.7 to 6.1 million, females is 4.2 to 5.4 million, HGB for males is 14 to 18. For females, it's 12 to 16. Hematocrit is 42 to 52 for males and 37 to 47 for females. White blood cells, 5,000 to 10,000. Erythrocyte sedimentation rate is less than 20. Blood lipid levels, so the total serum cholesterol, desirable is less than 200. LDL is low density lipids. Desirable is less than 130. High HDL is high density lipids for males greater than 45, females is greater than 55. And your triglycerides, the desirable is less than 150. Anticoagulant therapy coagulation times. So your PT is 11 to 12.5 seconds. Therapeutic range for anticoagulant therapy is 1.5 to 2 times the normal control value. Activated partial thromboplastin time, or APTT, is 30 to 40 seconds. Critical value greater than 70 seconds. Partial thromboplastin time, or PTT, is 60 to 70 seconds. greater than 100 seconds. Therapeutic range for anticoagulant therapy is 1.5 to 2 times the normal or control value. INR. Normal INR is 0.8 to 1.1. If the client requires anticoagulation, the desired value is increased to approximately 2 to 3. Liver function tests. So albumin is 3.5 to 5. Ammonia is 10 to 80. Total bilirubin is 0.1 to 1.0. Total protein is 6 to 8. Urinalysis. Specific gravity is 1.005 to 1.030. Protein is 0 to 8. Glucose is less than 0.5. Ketones is none. pH is 4.6 to 8. White blood cells, males is 0 to 3 per high power field, and females is 0 to 5 per high power field. Renal function. Serum creatinine. Males is 0.6 to 1.2. Females is 0.5 to 1.1. BUN is 10 to 20. Creatinine clearance test, males is 90 to 139, and females is 80 to 125. Therapeutic medication monitoring. Digoxin level, 0.8 to 2.0. Lithium level, 0.4 to 1.4. Phenobarbital, 10 to 40. Theophylline, 10 to 20. Phenytoin, 10 to 20. Blood glucose levels. Glucose, fasting, 70 to 105. HbA1c, or glycosylated hemoglobin, is 4 to 6%. Okay, so the levels of anxiety. Mild and moderate. The interventions is minimize situations that increase anxiety. Encourage problem solving and therapeutic communication. Severe and panic intervention is minimize stimuli, stay with the client, and use firm, simple statements. Phobias, you're going to provide support. Panic disorder is going to be slow, deep breathing. Obsessive compulsive disorder, you're going to allow the rituals. And generalized anxiety disorder, you're going to reframe from situation positioning. Okay, so schizophrenia. The phases: acute is onset of or exacerbation of symptoms with loss of functional abilities. These are delusions and hallucinations. Stabilization is symptoms diminish and client progresses towards previous level of functioning. Maintenance stage is the client is at or near baseline functioning. The med adherence and quality of life. The prodromal phase is gradual onset, mild manifestation, and months or years to acute phase. Nursing interventions is provide a safe environment. Ask the client directly about hallucinations. The nurse should not argue or agree with the client's view of the situation. Do not argue with the client's delusions. Avoid physical contact and touching. Approach in a calm and quiet manner. Validate their experience and promote safety. So childhood disorders, ADHD is difficulty focusing. This is a cognitive behavior. Autism is fixated early intervention program. Intellectual deficit is a learning disorder and it's school-based learning. Learning disorder is early screening and it's a psychosocial care. MDD is 2 weeks to 6 months. PDD is 2 or more years. Postpartum is 4 weeks of childbirth. These are depressions. So major depressive disorder, or MDD, promotes sleep routine, maintain ADLs. Symptoms is fatigue, anhedonia, anergia, and you need to encourage exercise. Social isolation is have them attend group sessions, and anorexia, have them eat small, high-calorie meals. Suicide. Patients that take SSRIs are at high risk. Risk factors include ideation, previous attempt, family history, and impulsive. Warning signs are drugs and alcohol, giving things away, saying I won't be a bother much longer, and all of a sudden they're happy. Initiate suicide precautions, assess plan, injury-proof rooms and bathrooms, remove all possessions from the client that could lead to injury, and one-on-one constant supervision. So for bipolar disorder, you're gonna the mania characteristics is anorexia and insomnia, extreme energy, excessive talking with pressured speech, indiscriminate spending, reckless sexual encounters, and risky investments. The nursing interventions is finger foods and using a calm approach. Assess whether client is a danger to self or others. Redirect and adapt a sleep-wake cycle. Cluster A is odd and eccentric. These are personality disorders. This includes paranoid, they distrust. Schizoid is emotional detachment. Schizotypal is extreme anxiety in social situations. Cluster B is dramatic and emotional. This is antisocial. They disregard for the rights of others. Borderline is self-image distortions. Narcissistic is lack of empathy and arrogant. Histrionic is attention-seeking. Cluster C is anxious and fearful. This is dependent. They're excessively clingy and submissive. Obsessive-compulsive, which is perfectionism and control. And avoidant, social inhibition and feeling of inadequacy. Addictive disorders, substance use disorder. This is impaired control, social impairment, risky use, and physical effects. So central nervous system depressants, which is like alcohol, so they're going to have delirium tremens 48 to 72 hours. Intoxication is slurred speech and impaired judgment. Withdrawal is nausea and vomiting, tremors, restlessness, and irritability. Central nervous system stimulants. This would be cocaine, tachycardia, dilated pupils, impaired judgment. Withdrawal is going to be fatigue, agitation, and craving. Opioids, this is going to be like heroin. So constricted pupils, decreased respirations, decreased heart rate, decreased blood pressure, initial euphoria, followed by dysphoria. Withdrawals is going to be diaphoresis, nausea, and vomiting. Dementia slow onset is slowly over months to years. Contributing factor is Alzheimer's disease. Cognition is impaired memory. Speech is incoherent, slow, and inappropriate. So Alzheimer's disease, the priority intervention is safety and promote routine. It is the most common cause of dementia. Eating disorders, anorexia, and bulimia. So the priority for anorexia and bulimia is assess health and safety. Focus on participation in the treatment and prevent purging and stay after the meals.